Welcome to Upstream University. In this video series, we will team up with some of the mental health community's most respected experts to explore effective and often new and innovative ways to address issues before they become serious mental health challenges. Together, we will travel upstream to understand ways in which we can reduce risks and increase resiliency, and to identify early signs of mental health needs when services and support can more effectively enable recovery. Today, we will look at a young individual's experience navigating the mental health services system and cover important factors that influence getting help. We'll also take a look at opportunities to increase access to mental health services for our younger generations.
I was 18 years old when I first started struggling with what I now know is bipolar depression, and within a 5-year period, I had seen 7 psychologists, 5 psychiatrists, been prescribed over 14 different medications. I had attempted suicide twice. I was deemed a 5150 on 2 accounts, and I have stayed a total of 16 days within inpatient psychiatric facilities. I had no idea what was going on at the time. Mental health isn't something you really learn in school. I don't think I had more than a page or 2 in a summer packet talking about mental health, let alone what to do when you were in a state of crisis. I mean, I knew I needed help. I just didn't know where to start. And what made it even worse and more frustrating was the fact that these services just didn't feel like the right fit. One of the first psychologists that I saw, I had explained my situation, and her response was, "I don't see what the big deal is." At that point, I just thought I hit rock bottom. But apparently, I kept digging, and I ended up being on my first 72-hour hold. I had this idea that I was going into some healing environment, and 3 days later would come out magically okay. But it was an absolute traumatizing experience. Once I was released, I just gave up entirely on the mental health system. I also think that a part of me wanted things to get better, and as confident as I was that they wouldn't, there was still that little hope. And things did get better. For a while, I was more open and willing to talk about my depression. And it's because that I shared with my best friend and her family that I have the psychiatrist that I have today. Everything was going really well for a while, and then I ended up in a really toxic relationship, and I spiraled and reverted back to my suicidal state. My parents had done their research, and they drove me 4 hours away to a neuropsychiatric facility in Los Angeles. It was there that I really learned the tools and skills of how to manage my depression. They set me up to succeed after my release, rather than just try to stabilize me during my stay. We did things like occupational therapy with emotional support animals, and we had a community garden. We did painting, and we had these self-reflection activities. And I think what really helped was the ability to connect, not only the staff members, but also the other patients. Being in groups with other people who really understood what I was going through and could relate helped so much in just realizing different perspectives of a same situation. When I was going over my exit plan, I realized that it wasn't just me who couldn't find resources. I was really empowered by my experience, and so I was inspired to start the Wildfire Effect, which is a mental health organization that works towards alleviating those barriers and challenges in navigating the mental health system. Although this experience was painful, it really brought purpose to my life. Without it, I wouldn't have found a passion for advocacy. I became the youngest member appointed to the Fresno County Behavioral Health Board, as well as a committee member for the Youth Innovation Planning Project Committee for the Mental Health Services Oversight and Accountability Commission for the state of California. And it's there that I'm able to really ensure that those with lived experience get to be heard, but also be an integral part of the development and the sustaining and assessment of current programs. I think that we should be creating more platforms where we can lift those voices. And there's this lack of collaboration between those who are providing services and those obtaining services. If we don't work together, there's always going to be a gap. We should be creating these platforms where people with lived experience can contribute their insights. They should be an integral part of the development and ongoing process of these services. We do need to make this a conversation and an ongoing discussion. It takes a community to solve and create these viable solutions. And I do believe that some of those solutions may already be out there. They're just not standardized. We need effective and reliable education, along with those quality services and intervention programs. We could save so many lives, and one of them could be yours.